I think many of us are tired from staying up late or getting up early, looking at various sources of news, all of which in some sense boil down to effective government. And so today, we want to talk about effective government and what makes it happen and what impedes it by taking a look at Japan and Korea with some experts on the legal system and the way the legal system interacts with politics and society. So we're very lucky to have with us today Eric Feldman, a professor of international law at the University of Pennsylvania, and Deputy Dean of International Programs over there. We've got Neysun Mahboubi, who's running the Center for the Study of Contemporary China, and Haksoo, professor of law at Seoul National University. Couldn't ask for three more knowledgeable people about the legal systems of Japan and Korea. And both of those countries have struggled with questions of administrative law, privacy, decentralization, and how they interact with effective pandemic response. And so, without any delay, I'd like to just go right into starting with Professor Feldman, asking what it is about the legal system and its interaction with the political system and society that makes a government effective or less effective in dealing with COVID-19.
And Rick, thank you very much. And thanks to Alexis and Catherine for organizing this and everyone at USALI. Just if you could clarify the format, are we having the general discussion now, or did you want each of us to take our few minutes to present in general?
Well, I think we'll start by having a presentation from each of you. I thought I'd start with you, Eric, then go to Haksoo, and then have Neysun clean up. And then I will take the prerogative asking the first question. And we'll be looking at the Q&A for questions from our audience.
Good. Well, thank you again. I know everyone, regardless of what side of the ocean or continent you're in, is probably a bit weary this morning. So I will do my best to stick to my 10 minutes. My timer's running, and off we go. I want to try to do two things in the time I have. First, just to paint a quick picture of where things stand today in Japan with regard to the coronavirus epidemiologically and how that compares to elsewhere, and then talk about some of the legal issues, both the things that may have facilitated or inhibited the government's response to it. The bottom line in Japan is that things are looking actually fairly good. Just a few months ago, in February of 2020, when the Diamond Princess cruise ship was docked off the coast of Yokohama, it looked like Japan was on the brink of a major explosion of the virus. I could tell you I flew back from Japan to the United States at that point, and nobody from my family was terribly happy to see me. They saw that I was a vector of infection, somehow invading from the east. But things haven't quite turned out that way. Despite Japan's rapidly aging population, and despite its high population density in large cities, there are just over 100,000 cases of the coronavirus in Japan and about 1,800 deaths. The 100,000 case total is about what we're seeing daily in the United States now, and the 1,800 deaths are about a 2-day death toll in the United States. US, sadly, these days is going to lose in any comparative endeavor. So I would take as Japan's peer countries here, the G7 countries. And if one looks there, the best performing G7 country after Japan would be Canada, with a population about a third of Japan. And if we look there at per capita cases, we see about 7 times the number of cases in Canada than in Japan, and about 15 times the number of deaths. And after Canada, things rapidly get worse. Germany with over 500,000 cases, the UK with 1 million, France well over 1 million, and all of them in the tens of thousands of deaths. So my overall assessment, if we take what I think is the bottom line measure of a pandemic, which is how many people are sick and how many people are dying, and how well is the government doing in keeping its population healthy, I think Japan is doing an awfully good job. That doesn't mean it's doing the best job. Some have said, well, gee, don't compare Japan to the G7, compare it to Thailand, to Vietnam, to Korea, to Taiwan. And indeed, compared to some of those countries, Japan isn't arguably doing quite as well. But it seems to me in the broader picture, the fairest conclusion is that things in Japan are looking pretty good. There are lots of different ways to explain that, obviously, and today could be about culture, today could be about luck, but today's about law. So I want to look at, in the few minutes left that I have, a couple of ways in which the legal system may be inhibiting or may be facilitating the kind of numbers we're seeing in Japan. I'm going to highlight 5 issues. First is that it seems to me that coronavirus has exposed tensions, long-standing, but perhaps getting a little bit hotter these days, between the centralized bureaucratized government and regional governments. A number of local leaders in Japan, notably the governors of Hokkaido, the governor of Tokyo, Osaka, and Wakayama, have sought to and tried to develop local policy, at the same time trying to boost their national profiles, but their ability to do that has been sharply limited by a set of infectious control disease laws that provide authority to the central government, and the authority of local governments is largely derivative. This is spelled out, not surprisingly, in Article 8 of Japan's constitution that looks at the balance between central and regional governments. But I think what we see with the coronavirus is that a set of tensions that have long been there between central and federal have started to increasingly move to the fore, with various administrative law scholars in Japan raising the question of whether or not this suggests some degree of alignment. Legal scholar Dan Rosen has likened this conflict to Japan's feudal past, where you have these feudal warring states with a tension both between them and tension with the center. I think that's a nice and dramatic way of thinking about the situation. It's certainly less dramatic right now, but I think that's an area to keep one's eyes on. Second issue, constitutional revision in Japan has been on the agenda for a long time, though it's never happened, and Japan's post-war constitution remains unchanged. But the focus has generally, by the politicians, been on the revision of Article 9, the pacifism clause, so-called, of the Constitution. But the inclusion of emergency powers in the Constitution has come increasingly to the fore as a consequence of the coronavirus. It's not brand new. Back in 2012, when then Prime Minister Abe, recently retired, had suggested and pushed for constitutional revision, including emergency powers in the Constitution, was one of the 4 prongs, but a kind of minor one. But as the coronavirus has moved along and the Prime Minister has suggested that he ought to have more power to immediately impose a state of emergency and have the cabinet pass laws as if it were a legislative body, the tensions over constitutional revision have increased. It's probably no surprise that civil libertarians in Japan have recoiled at the idea of enabling the prime minister to have more power and have the cabinet, in a sense, act as if it were a super parliament and make laws. They see this as the opening of the door to the abuse of civil liberties and civil rights that occurred in the pre-war and wartime period by Japan's military secret police. But I think here too, it's worth wondering whether or not emergency powers may ultimately turn out to be the wedge that enables constitutional revision that hasn't happened as a consequence of other sorts of stimulus. Third, the Japanese government's effort to control the virus, or I should say the general effort to control the coronavirus, has highlighted the Japanese government's weak legal authority with regard to lockdowns. There was a lot of maneuvering before the government convinced the Diet to amend the law, include coronavirus in the infectious disease law, in the pandemic influenza law, I should say, and announce a close down. We can talk in the Q&A about what impact the effort to hold on to the idea of having the Olympics may have had on that delay. But without a declaration by the central government of an emergency, prefectural governors were hamstrung. They had no legal power to do much at all in terms of controlling businesses or individuals until the central government acted. Nonetheless, even when the central government acts, all the prefectural governors can do is make requests to businesses and individuals. Please stay home. Please curtail your hours. But those requests have no enforcement power. They have no legal teeth. So finally, by mid-April, when all of the prefectures were under the state of emergency declaration by the central government, the local governors had authority to do something, but they didn't have authority to do much except to request and plead. Fourth issue, despite that, despite the lack of enforceability with regard to closing down or slowing down the economy seems to have slowed down and people stayed home. And the question is, why is that? And I think most commentators point to what many describe as soft law, administrative guidance, social norms, peer pressure. And those take various forms, from a ministry that regulates a particular industry, communicating directly to that industry, to people staying home because they are told to stay home and they know it's the right thing to do to stay home and they know it's appropriate to try to do their part to prevent the pandemic, to what the Japanese have come to call jishuku keisatsu, which is the self-restraint police, a kind of self-appointed vigilante neighborhood busybodies who prod and poke their neighbors to comply and act appropriately in the face of a pandemic. Fifth issue, I think one wants to appreciate policy here. What is it that the government did to contain the coronavirus? And I'd say there, they focused on border controls on the one hand and what they call cluster busting on the other, identifying infections and doing aggressive contact tracing through the 469 local public health centers under the auspices of the Ministry of Health and the 25,000 staff people who weren't able to rely on apps. So they did the laborious thing of picking up a telephone and contact tracing through personal contacts. And while it's always hard to know exactly what the cause and effect are of these sorts of policy moves, clearly the results are good, and the Japanese government's relentless messaging about the 3 C's, avoid crowded spaces, avoid poorly ventilated spaces, avoid close contact. The C is closed, crowded, contact. I should highlight those 3 C's because the government should. And the very last issue I want to raise is the underbelly of the arguably the failure to rely on the rule of law and instead the dependence upon social pressures and such, which is what appears to be the existence of a variety of types of discrimination in Japan around the coronavirus, what's called corona ijime or other things in Japan, where people who have tested positive are somehow thought to have been at fault for that. People have been told, don't send your kids to school, don't come back to work, you're a germ, you're shame on you, etc. I have no sense of whether there's more or less discrimination in Japan, but I think in the context of the overall success story I'd want to tell about the numbers in Japan, we also need to appreciate that much work needs to be done in some of these other areas, and discrimination in human rights is one of them. Thank you.
Thank you so much, Eric. That was terrific. Haksoo, what do you think is drivers of success and failure in Korea?
I'll explain that, and I have slides, so that let me share my slides. Yeah, thank you for inviting me to this important event. I'll focus on privacy and other related aspects, which would, if in the US, fall under the rubric, roughly under the rubric of the First Amendment in relation to contact tracing. Contact tracing has been instrumental, perhaps the most important instrument used by the government in South Korea. And today, the whole country has roughly 50 million people. And out of 50 million population, about 20 7,000 people are infected, tested positive. And the number of people who are dead is about 470. So in terms of the people who got tested positive or who are deceased, the country has been, compared to other countries, relatively speaking, pretty successful. And the main factor, as I mentioned, is contact tracing. And this slide shows the main sources of the information. And I would say it's a two-way street in the sense that from various sources, the government gathers all the relevant information. The information is gathered at Korean CDC. So Korean CDC works as a central repository of all the relevant information. And the main sources include location information gathered through mobile carriers. And another source of location information is through credit card companies. So in Korea, everybody, all the nitty-gritty small transactions at grocery stores are done through credit card or debit card. And once you have transaction history, you can easily locate the one individual's itinerary. And there are many other sources of the information, and all those different sources of information eventually go to the Korean CDC, and they do obviously epidemiological analysis. And then once they do the analysis, they disseminate some part of the information to the general public. So one, I mentioned two-way street. So one way is from the general public to the Korean CDC. And the other way is from the Korean CDC to the general public. The Korean CDC does daily briefing, and also it sends information to local governments. So Korean CDC does daily briefing, and also local and municipal governments do their briefings and disseminate information to the general public. So, this two-way street scheme, there are different sources of issues that can be debated. This shows the location information from mobile carriers is the crucial source of the information. And in particular, in the early days in March and April, very extensive information was disseminated to the general public, and this table reflects that. South Korea has more kind of extensive list of the information items disclosed. And if you live in Korea, you get on the top of the screen emergency alerts. You get daily alerts like this every day, several alerts through your mobile phones, and that indicates the central authorities are tracking where people are. And by the way, in Korea, it's not done through a mobile app. It's a national sort of national information system, and there has been some critical view of doing this very extensive tracing done. And I'll illustrate some of the issues that have been raised. One, this is one episode of a group of national fencing team members having, after joining international competition, having their own retreat or vacation in a small city, a village in seaside. And they, some of the team members got tested positive. And the local government announced like this: the fencing team has vacation. 3 of them got tested positive. One of them was 25-year-old female. These were not just fencing, but LP, which is a subcategory of fencing. And LP had 8 team members. So they didn't tell names of these individual players, but the information revealed was really very much revealing. And I, as a scholar in this area, I was curious whether I could easily find who they are. And I did Google search, and within perhaps a minute or two, I could very easily identify them. So voila, this is a screenshot from the Korean fencing team, and you can find female épée team members, and they are these 8 players, and there are names, and if you click the photos, you can see how old they are, and in what town they live, what kind of team they belong to. That sort of information can easily be identified. So there have been a few occasions like this, in which some people, although their names were not revealed by the authorities, they could be identified. And another episode was reported to New York Times, and this was about churchgoers, and the authorities didn't reveal the names, but they revealed itineraries of the people who got tested positive. And the rumor mill had made inferences which was proved wrong. And the inference was that these 2 people in the picture, one of them spent quite some time with another person in the same hotel for extended period of time. And the suspicion was these 2 people were engaged in extramarital affair. And that was not, simply incorrect, not correct. And the reason why they spent time in a hotel is because the church choir, I think, they had some sort of meeting there, and it was just natural for them, members of the church, spend time in the church. But rumor mill had other inferences. So these people had very hard time explaining what transpired. And one of the major sources of the infection, where many groups of people got tested positive, were churches. And in particular, one type of church called Shincheonji itself has been controversial, but the way they conduct their services perhaps was conducive to getting infected. And somehow, the whole church, the whole sect was considered sort of very taboo, and the authorities demanded the whole list of members of the church, and the church declined to do that, and the authorities raided the church and tried to invade the whole IT system so that they can gather the whole list, and there have been that sort of episode, and there are lawsuits going on, and the people who would belong to this church would right now at least would never tell their acquaintances that they go to this church, because telling, revealing you belong to this church would have tremendous taboo subject to tell. And another source of infection was clubs, where young people would go and spend time in close contact with other people, and in particular, district where there are quite a few clubs. Some of them were gay clubs, and one particular gay club had a number of people who got tested positive. And after that episode was revealed, LGBTQ community was under attack, and they got context from the authorities, and being fearful to be forced to come out, they tried to hide themselves, and that sort of episode was pretty much revealing what is happening. In the sense that some people would say, why do you have to go to a club, or even further, why do you have to be a homosexual, and that sort of attitude, and also the authority is trying to have a contact tracing scheme in place. They made contacts all the people who spend some time, say half an hour or longer in this district during the weekend. That number counted over 10,000 people. And just because spending some time in this neighborhood, in this district, meant you would get some level of suspicion from the authorities and getting contacted by them. And that sort of issues would go to constitutional level. And the picture in this slide is not about COVID-19 per se, but from a few years ago. Our previous president right now is in jail, and she was actually kicked out of the office after having this protest by the people in the country. For a few months, people gathered in like hundreds of thousands every weekend with candles in hand. And this is a central square called Gwanghwamun Square, which is located in central part of Seoul. So this square is kind of has symbolic meaning because of this history. And this is a picture of the same square last month, a national holiday. In this same square, nobody is inside the square, and the reason is because this square was circled by the buses that you see, and the buses were from the police. These buses are all police buses, and buses were lined up like this, and so that no individual was allowed to go in. So in that sense, the criticism was that the freedom to have gathering, freedom of assembly is hindered that way. So there are this kind of controversies, and nowadays the country adopted QR code system so that whenever you go to a restaurant or business establishment, many of the business establishments, you would have to scan your mobile device with your QR code, so that if things happen, you could easily get contacted. And there are some controversies or some concerns raised about privacy related to this scheme. So this is the last slide. In general, in terms of containing the spread of the virus, South Korea has been successful. The number you see on the screen, 80%, that is about the authorities finding out the sources of the virus, or making sort of successful, maintaining successful contact tracing scheme. But the expense would be this sort of controversies related to privacy, religion, or assembly. Those are the issues have been raised. So, well, the whole country or the whole society will have debates in that respect. So I'll finish with that.
Well, Haksoo, thank you so much. That was a really interesting explanation of the costs of an effective response. Neysun, stepping back a little bit, how would you characterize the general features of the Korean and Japanese response? And I also want to emphasize, I had said earlier or suggested that you were the leader of the Center for the Study of Contemporary China. You're much more important than a leader, you're a researcher, right? Although I appreciate all of our leaders. So with that correction in mind, what's your take on this?
Sure. And I should say, I almost did take a page from our current president and give myself a promotion simply by declaration, but I don't think our system works like that. So, so first of all, I just want to thank you, Rick and Jose, Kathy, for the opportunity to speak with you all this morning. And I see many friends and the participants. I see Jerry. So of course, in our new virtual world, I can't see Jerry in person, but I do want to say hi to him as well. Let me step back for a second and situate my reactions to these great presentations by Eric and Haksoo by mentioning again this resource of the essays that were published in the Regulatory Review over the course of the spring, including essays by Eric, and I know May is going to be speaking next week on Vietnam. She had an essay as well. That covered about 40 different essays that covered about 22 different countries, including many Asian jurisdictions. And so my thoughts are largely taken from looking at that big picture and following the Asian story. The other thing I want to say is, of course, as many of you know, I particularly specialize in China. And for all of us who study China, I think it's hard to overstate how dramatic it is that in late February, we were looking at 77,000 cases in China and thinking that that was something that might put the viability of the regime in danger. Not everyone thought that, but at least more than a few of us, including myself, the thought crossed our mind. And so we fast forward from late February till today, I think it's November, something like that. And the case number from China, if you look at the current reported cases, and I know we all are a little bit suspicious of the reporting of cases from China, but it says that there are 87,000 cases in China with an increase of 17 cases per day, contrasted to the US, which has 9.4 million cases with an increase of 92,000 cases per day. And of course, very sadly, 1,000 deaths a day, whereas China reports 4,000 deaths altogether. And even if we want to take issue with some of that, the numbers from China, that gap is quite massive. And so for anyone like myself who studies China and is also thinking about the US, that comparison is incredibly dramatic and is one that causes, I think, a lot of soul searching about different forms of governance. What I particularly appreciate about this series that you're doing with the presentations this week and next week is you're highlighting other Asian jurisdictions other than China that have also done an excellent job of managing the pandemic without necessarily using the most intrusive methods that cause concern in China. Of course, in China, you have extremely strong lockdowns have been part of the story. You have surveillance through apps that we could maybe discuss this later, may not be completely different from the kind of contact tracing that we're hearing about today in South Korea that I'm sure May will talk about next week with respect to Vietnam. But they are against the backdrop of a more repressive regime in China that we're more concerned about how that data can potentially be used for nefarious purposes. And going to what my real goal here is, or my real task is here, to talk about South Korea and Japan. What really strikes me, looking at these two countries against the backdrop of the broader picture, and particularly thinking about the US and China, is one, and even there are differences, clearly, that we've just heard Eric and Haksoo talk about between Japan and South Korea. But in both countries, there tends to be a real emphasis on scientific expertise in the regulatory response. There seems to be a high degree of social compliance with the communications that are sent out from the government. Compliance that in Japan, certainly, and Eric has written about this in his essay for the regulatory review, is in many ways voluntary. So, you know, with belief and expertise as a premise of regulatory action, clear communication from the government, compliance that, again, you know, there may be differences between Japan and South Korea in this respect, but is not as much of a hard thing to achieve as we certainly find in the United States, where we're having so many issues with both mask wearing or agreeing to stay home and self-isolate when one is sick. We have even our political leaders are not necessarily willing to wear masks or to self-isolate. Our highest leaders are not willing to self-isolate. And that seems to be a huge difference between the US situation and what we see in South Korea and Japan. I understand the privacy concerns that Haksoo is talking about with respect to some of the contact tracing apps in South Korea. And I'm sure that that's something that we could also talk about in the context of Vietnam. Whether or not that degree of intrusiveness in our electronic approach in the US could be accepted, I might have to defer to some of our more expert American scholars to talk about that. But I think the contrast with China is less to do with the technology itself, but the overall government system in which it's embedded. And so that's something to keep in mind. And of course, you know, there are scholars in South Korea, let's say, as we've seen today, who can ask those questions about whether privacy is an issue. And that may be a discussion that's harder to have in China. The last thing I'll say before I know we want to move on to have cross-cutting questions and discussion from the audience, there's a cultural element here that I don't think either Eric or Haksoo has brought up, but I keep coming back to in my own thinking. And I know that everyone feels a little bit uneasy about talking about culture. Mm-hmm. And I think that's partly because we're worried that we don't want it to be essentialist. But I am comfortable with the notion of culture as something that's socially constructed. And in that sense, what seems relevant to me is that all of these countries in Asia, certainly China, South Korea, Japan, Vietnam, other countries, have had experiences with similar viruses in the past 15, 20 years that have helped to shape social behavior. So whether we go back to the SARS crisis in 2003, or we go to the MERS crisis in 2015, there has been an opportunity for learning among the population in these countries, and then also feedback back to the government that seems relevant here. And so when we hear reports of more widespread mask wearing in all of these countries, and I think that is something that is certainly the case, whether you're talking about China, Japan, South Korea, Vietnam, all of these countries have much higher compliance and voluntary compliance with wearing masks. There is a cultural element to that, and not because of any essentialist claim, but because there's this social experience of having had viruses that learning to wear masks has been very helpful. And so as much as I think that, you know, things like expanded testing, which of course South Korea is quite a leader in, or contact tracing through apps, more effective approaches to home-based isolation, as much as those things are important, what I keep coming back to in my own mind is how something as simple as wearing a mask, which is common throughout these countries that have had the experience of SARS and MERS in the past, has had such an enormous impact. So I think I'll leave it there for now, and then we'll keep talking with your questions, Rick, and those from the audience.
Well, Neysun, thank you so much. That was terrific. I really appreciate, by the way, that last idea of understanding culture as social learning, which is not usually how we think about it. You know, I always think of culture as being the part of the map where they just draw a big sea serpent and say, there be dragons. And they have no real, if you don't know how to explain something, you throw in the cultural variable because you don't actually have a good cartography. But that's actually a really nice way of thinking about and perhaps even operationalizing culture. I had this question for everybody. Recently, I wrote an essay with John Farrajon on COVID response in a variety of nations where you have polarized politics. And one characteristic of Japan and Korea is that the level of polarization among the parties, among the political parties, seems to be lower than the level of polarization in, for instance, England or the United States, two countries that have had a very ineffective response to COVID. So I guess I want to ask you, to what extent does the kind of social compliance and cooperation and the kind of trust and expertise really depend upon a particular pattern of party participation, about widespread public party participation in which partisan polarization is less intense and party affiliations are more overlapping. That is to say that the belief systems of the members of different parties overlap a lot, when they don't overlap in the United States that much. If you have any thoughts about that, partisan behavior and COVID in Japan and Korea.
Professor Ko, I'm happy to defer to you first, and then I'm happy to jump in.
Okay. I would say in the case of South Korea, I would say there are two aspects. One is the politics in South Korea is also polarized, not as much as in the U.S. maybe, but right now pretty much polarized, and nonetheless, in terms of dealing with the virus, the role of professionals was highly regarded, and in particular, the professionals at the Korean CDC. They were doctors and career bureaucrats, and generally speaking, although they are part of the government operation, to at least to some degree, they were perceived to be independent professionals. So they were viewed, they would follow the direction from the central government and politicians. In at least to some extent, they try to maintain their integrity, and that worked in their favor and also in favor of the government. So when they gather the information, contact tracing information, when they serve as a central repository, the general population wouldn't have a doubt that Korean CDC would utilize the information to get political favor. And that was, I think, very lucky in the sense that the IT information system could have been located some other government agencies, but somehow Korean CDC maintained the role. That was in contrast to what happened in the U.S. The U.S. CDC, served some purposes, but there have been tensions between White House and CDC, and the White House was trying to serve as a role of, among others, gathering relevant information. But in South Korea, didn't work that way. And another is, as Neysun mentioned, the people's attitude of wearing masks and doing that sort of social distancing, engaging in social distancing measures. When we go out on the street, even on the street, when you're alone, people tend to wear masks. So wearing a mask is a symbol of, in a sense, social solidarity. And if you don't wear a mask, you would look very conspicuous. And it's kind of minimum civil, it's viewed as a minimum civil duty as a citizen. And that sort of attitude is prevalent. And well, it could be a culture, people would describe that with different interpretation. But for example, vaccine, flu vaccine, people in South Korea wouldn't have a doubt that when there's flu season, we'll need to get vaccinated. But some people are getting anxious. So this fall, it perhaps one of very few occasions in very long time. There are a few people who died after got vaccinated for flu, and that became scandalous, and there was some hesitancy among the population, but that was very exceptional. And for every year that I remember, the flu season comes and people would get vaccinated, and that's kind of general social attitude. So in summary, I would say Korean CDC maintained its professional integrity and at least some degree of independence. And the second, the general public attitude of maintaining social distance and in particular wearing masks, that I think that helped a lot.
Well, that's very interesting, Haksoo. Eric, what do you think?
So a couple of parts to your question, I think, Rick. So let me try to break it down into three pieces. First, in terms of the political divisions, I guess I'd want to differentiate the degree to which different political parties are really divided ideologically and the degree to which those ideological differences in the end matter. So I would say in Japan, you do find some sharp differences. For example, the opposition parties initially were strongly opposed to the amendment of the Pandemic Influenza Act. They didn't think it was necessary or desirable to have to specify the novel coronavirus as a virus that was applicable under that law, et cetera. But they gave way in the same way that they have strong views about constitutional revision. They have strong views about what ought to count as the powers of the prefectures, et cetera. But the Liberal Democratic Party in Japan is dominant. It has been since the post-war period. And so while it sometimes needs to sort of caress and cajole the smaller parties, it largely gets its way. So I think political differences are there. They can just be overcome. The second part of your question, I think, has to do with trust and confidence and faith in expertise in science. And here I've got to say, I don't know why I didn't learn this lesson 4 years ago, but I think we're all reminded again today about how skeptical we need to be about public opinion polls and surveys. So what I say with some doubt, but I think the public opinion polls in Japan generally suggest that trust in the Japanese government is extremely low. And the Japanese public tends to think the government, i.e. the politicians, did a uniquely poor job of handling the coronavirus. A kind of fascinating finding if it's true, when you look at like, how is it that the government is like no good deed goes unpunished here? They've saved the country from a pandemic, arguably, and everybody's mad at them. It seems to me one might suggest that while if the public opinion polls are right and that people take a dim view of politicians, they have a much more higher degree of faith in their scientists. Though I think what we have seen, at least my casual observation of this in Japan, and I think this is true everywhere, is that there's been a significant degree of disagreement among experts about what to do. So you may have confidence in science, but do you trust Dr. Atlas or Dr. Fauci? They're both scientists, but some consider one a fraud and one a genius, and others flip that assessment. And we've seen that to some degree, though not as aggressively in Japan. There's a very famous Nobel Prize winning scientist who has had a lot to say about the coronavirus. And some people think, therefore, his fame and glory ought to lead us to trust him. And others say, this isn't his field. He ought to shush up and let the infectious disease experts carry the day. I do think at the end of the day, the Japanese government has been far more science-based than the US government. But there too, I'd say the very first thing the Japanese government did, this was Prime Minister Abe at the end of February, was go in front of the public and suggest that all schools close. And it seems to have been fairly well documented at this point that that suggestion was made in the absence of any input at all from his scientific advisors. That was his gut political instinct. It may have been a good one, but it wasn't one that was based on an assessment. And lots of people afterwards said, well, gee, you closed the schools. Now, lots of the healthcare professionals who have kids are going to stay home, and we've now drained expertise from the healthcare system. The third part, I guess I'll hold off. I don't want to do a Mike Pence and say thank you for the question and then answer something totally different. But I'm dying to say something about culture. So I hope we're going to come back to that.
Well, absolutely. In fact, I'll make sure that if nobody else asks that question, I do.
Let me jump in. Can I jump in too? I wonder how much this question of polarized politics is hard to disassociate as an American from our own experience here. How much of that is a similar story in other countries, and certainly the two countries that we're focused on in this discussion. You know, in the US, it's been argued, and I think convincingly, that early in this pandemic, this administration decided that this was a blue state issue, and it was not something that they needed to worry about in terms of their red state voters. And I do wonder, just as a thought experiment, if the pandemic had initially hit the red states, would the politics of this be completely different? Or at least would the administration's response be different? One could imagine an alternate universe where the red states were hit from the beginning, and you know, this became sort of a new sort of post 9/11 type of government response that maybe in fact would have generated enormous approval ratings for the president's handling. And I just don't know enough about the politics of Japan or Korea, and certainly we don't have the same issue in China, to know how much that's analogous. But there's some things that Eric was saying that made me also reflect that I've generally been seeing this not so much through the lens of partisan politics as attitudes towards regulation. And so, Rick, when you asked the question, you mentioned the UK and the US, and one could say those are very polarized politically, but another thing that they share in common, and they also share in common with Brazil, is political leaders who take a aggressive attitude against regulation. And that to me, and in the US, you know, our particular breakdown of partisan politics seems to track attitudes towards regulation, or at least there's some convergence there, but that's not inherently necessary. It could be that partisan politics would be fighting over something else. And specifically what Eric said, that I didn't know, and obviously Eric knows a lot more about Japan than anyone, and certainly more than I do. And so if we were in the pandemic, I'd go over to his office.
Just correct that, because there are some folks on this call who certainly know a lot more about it than I do. So
more than me at least. And so I defer. You know, I'm learning from Eric as we're having this discussion, and I just wonder if my surprise at what he was saying about the attitudes of Japanese towards the government can be harmonized with my earlier notion of it, based on the difference between political leadership and the bureaucracy. So, you know, and Eric, you said that there's trust of scientific expertise in Japan, even though there may be, as you just said, that there may be some dissatisfaction with the particular political leadership. In the US, obviously, we have this distinction now generated by our president between the notion of the government and the deep state, where people are, and I tend to think of the distrust of the deep state as being aligned with distrust of science, you know, and expertise. But it seems plausible to me in Japan that the civil service still maintains a high reputation, and this voluntary compliance that you've written about is rooted in part in the respect for that, even if there is dissatisfaction with the political leadership.
Well, that's really, you know, the distinction between the state and the government is a really important distinction. When this question just came in for Haksoo, could you say more about, it's from Jose, I'm just going to read it. I mean, Jose could actually speak it out, but Haksoo, could you say more about what is the likelihood that many of the controversial aspects that you describe in the response to COVID will lead to lawsuits in the South Korean courts and what the result will be? Do you have a sense of where or how the balance between the protection of public health and privacy will be struck by the courts?
Yeah, that's an excellent question. And there are indeed several lawsuits currently pending. And in Korea, there are, in a sense, two different court systems. One is sort of regular court with tertiary system, district court, appellate court, and Supreme Court. And the other court system is a constitutional court. So in Korea, there is separate constitutional law court, and some of the lawsuits basically about civil penalties and I mean administrative penalties and civil lawsuits, and some of these lawsuits are very simple, and more difficult lawsuits are about constitutional values and how to place privacy in the whole society. And in terms of statutory interpretation, in Korea, there's separate law called Contagious Disease Prevention Act. And this Contagious Disease Prevention Act, it has been active during this pandemic. And there are two types of people who are subject to this particular statute. One group of people are the people who got tested positive, and the other group of people are who are suspected to be tested positive or who are in close contact with the people who are tested positive. So the second category of the people, who are suspected, who could possibly be exposed to the virus, and who are these people who are subject to some special scrutiny that has a lot of privacy implications. So for instance, the district that I mentioned, where there are a lot of clubs and night establishments, young people go there and hang out and meet friends, and just because they spend some time there during the weekend, they got contacted by the authorities and they were categorized as the people who are suspect. And so in Korea, there is a notion of proportionality. So, out of over 10,000 people who got contacted by the authorities, maybe some portion of the people had sufficient reason to be contacted by the authorities, but some other people are just passers-by or just spend time in the street or coffee shop, never hang out at more clubs or other establishments where they were in close contact. So how would you define proportionality? How would you apply the notion of proportionality in that kind of context? That would be one big question. And the other, there are a few, but another example would be the freedom of assembly. The picture that I showed in the large square, the bus blocking the entry into the square, and no one's individual citizen would be allowed to go inside. And actually, some people who spend nearby in that neighborhood near the square got contacted by the authorities, and they also brought a lawsuit. They were saying, I just passed by and took 20 or 30 minutes, and just passing by and taking 20 or 30 minutes. Why should the police or the authority had to categorize me as suspect class and contacted me? And that sort of the question was never raised in the Korean constitutional context, and they'll be basically a little bit about proportionality principle applied in these unique fact circumstances.
Thanks a lot. That's really helpful. We have it is now at, by my watch, of course, 11 o'clock at night. I'm in Shanghai, China, by the way, right now. Just got out of quarantine. So
Can I ask a follow-up quickly to Haksoo?
sure.
Haksoo, I'm just curious, as a scholar of China, I'm very aware of how the Chinese government has used its success in combating the coronavirus with specific reference to the US's lack of success to generate popular support, and that there's a genuine, authentic national pride at how well China has done this vis-a-vis the US, because obviously China, there's a lot of other countries, but China is always thinking of itself in comparison to the US. And I just wonder if in South Korea, we often in the US, there's a lot of messaging around the fact that the first cases were reported in South Korea and the US on the same day. And then we had widely divergent paths after that. And so I just wonder if politically in South Korea, there is the same degree of pride, either generated, from the top or from the bottom organically in this relatively successful, because I understand that there's going to be concerns about privacy and the types of things that you've been discussing, but I just wonder if it's also within the broader context of, hey, look, we did a pretty good job with this, and we didn't have to do, the kinds of things that they did in China that were extremely intrusive. So, good job for us. Is there any of that in the political landscape in South Korea?
Yeah, I mean, that's a very good question, and also a very sort of sensitive question. I would say that in general, general population is very proud and feel good that we don't have too many people who got tested positive. So the number of the people who got tested positive itself is very good news for the whole country and also for the government. And how to interpret the broader situation, there are different views. So some people would give so much credit to the government, and some other people would say we pay too much cost in terms of civil liberties and having the government turning to more kind of authoritarian attitude, and that cost was too much. So some people would support the government. This is inevitable. It's a cost worthwhile to pay, and some other people are very adamant, and the government was using this as an excuse to revert back to sort of authoritarian attitude. So there's kind of polarized view of the whole overall situation.
Well, we're at the time in which I want to point out questions are beginning to come in on the Q&A, and I want to open up the discussion to all of our participants here. One of the big questions that came in was, look, what has the society learned from the experience? Could Professors Feldman and co. Elaborate on what Japan and South Korea learned and how the government and the society changed in response to the SARS and MERS experience, and how they look like they may change in response to the COVID experience? And this overlaps with a question that Catherine asks. Look, could Eric give a few examples of the permanent effects he anticipates? And could Haksoo and Neysun also comment on the lasting effects? What's going to come out of all of this? And how does that compare to what's come out of pandemics in the past?
Great questions. Obviously hard to answer, and particularly hard to answer because it seems to me we're not nearly at the point of being at the end and being able to, in retrospect, figure out what happened. I think there's still a possibility that, arguably both in Japan, Korea, and maybe even in China, we can all be here on a webinar today, feeling like compared to the US, these are countries that have largely been spared a devastating pandemic. And in 6 months, we may have a very different story to tell. what one would describe as success today. You know, Pennsylvania and my hometown of Philadelphia looked awfully good 3 weeks ago. Some of us are teaching in person. Restaurants are open. Life has returned to the streets, and now cases are doubling, and there's lots of questions about yet another lockdown. So I worry that I'm going to repeat a mistake I made some years ago when I was doing some work on medical malpractice in Japan. And the question I was trying to answer was, why were the medical malpractice litigation rates so low? And lo and behold, as soon as I finished the paper, they started going up. And I thought, gee, you know, my timing here couldn't have been worse. So still, let me poke at it a little bit. It seems to me Japan and I think it was Masa who asked the question, and I'd love to hear his views on this, but it seems to me Japan probably didn't learn all that much from SARS and MERS and such, because it didn't have a significant problem. It's the H5N1 avian flu that people tend to look back to in Japan as to, gee, what should we do? I know the former governor of Tokyo has been quite sharply critical of the current Japanese government's management of the coronavirus, because he says, look, you know, I did a better job. What I did in terms of closing down the schools and invoking legal approaches is far better than the government's doing now. That would suggest that there's at least some in Japan who feel like lessons haven't been learned, that lessons could have been learned, but failed to do so. I think another piece of that is that there's been some controversy over what the right law is to rely on in the face of a pandemic. Japan has what continues to be vexing to me set of laws. It has the infectious disease control law on the one hand, which was a 19th century law revised in the late 90s. And then it has a law specifically focused on emerging influenza pandemics. And those laws interact in a variety of ways. And there's thoughtful folks on both sides of, gee, the government should have relied on law A as opposed to law B. There was a controversy as to whether or not the pandemic influenza law needed to be revised or not, because the question was whether the novel influenza, the coronavirus, was a new disease or not a new disease. The word novel suggests that it's new, but it looks a lot like other influenzas. And so I'm always hoping lessons have been learned. I hope politicians learn from their mistakes and that bureaucracies get better, and that the next time around they do a better job. But I haven't seen a ton of evidence so far that engagement with past epidemics has been tremendously helpful. I guess the last one I would harken back to is HIV/AIDS, not one that was on the agenda of what the question asker was, but as I listened to Professor Ko and the language of coming out, the balance between, do we force people to be tested and contact trace and do what we can to ensure that people are engaging in safe sexual relations, or is that going to drive people underground, has been very resonant to me with the debate about testing in Japan. Japan is an incredible under-tester for the coronavirus. If we compare it to other places, there's been just a couple of million tests in Japan. And one of the reasons, I think, is people don't want to get tested because they don't want to be outed. They don't want to be discriminated against. They don't want to be known. They don't want Professor Ko to be able to go on the internet and find their pictures like he did with the wrestling team. And so I think maybe there's been some, if not lessons learned, at least some interesting connections we could draw between the way in which the HIV/AIDS was handled in Japan, where there too, Japan didn't have a significant problem compared to many places, and the coronavirus. The obesity epidemic is another one, and fat shaming I think would be interesting to tie in here. But I'd love to hear what Professor Ko has to say on this specific question.
Yeah, I'll add a few words about South Korea. And first, MERS, South Korea experienced MERS and very small, relatively speaking, small scale. We had several thousand people who got infected with MERS several years ago. And that experience helped a lot in terms of setting up the scheme for contact tracing and dealing with epidemiological aspect. So the epidemiological professionals, I mean, I spoke with some of them, and they knew, how to set up a scheme for contact tracing. So in that respect, experience helped. Another aspect is, the privacy and related aspects that I mentioned, that sort of raised a new level of issues for the, the general population. I mean, in Korea, there's separate law dealing with privacy, and that law was enacted 2011. So the law is relatively new, less than 10 years old, and the law was had very large impact in the whole society. But at the same time, the law was viewed to be only among experts and government bureaucrats who handle the law. I mean, and it didn't have kind of real serious impact on the general population. But now the whole society has to deal with privacy issues. What is privacy in this particular context? So, the population is put into this situation where they have to agonize over, several different aspects with constitutional values. So in that respect, it's kind of like a live classroom where the whole society has to engage in debates and sort out among different constitutional values. So in that respect, it has been very interesting and good experience for worthwhile experience for the society. And another aspect is the role of the government in general. Including South Korea, many other countries. I think it's a general tendency that the government is assuming more and more role in the whole society. And one example in the case of Korea is there have been a few occasions during this year the government budget has been increased and so that they can spend more money. In the past, that kind of a few extra ordinary budget during the same year has been unimaginary. But this year, just because of this pandemic, having over budget in a very large scale suddenly tolerable to everyone. And once this is in place, the budgetary discipline could easily disappear, and we'll have to see how this will have a longer impact. So the government role, traditionally in the Korean society, from the 70s and 80s, in the high growth period, the government played very active role, and possibly in some different permutation, the government role would again be emphasized.
Well, both of those insights on the way that government has changed or not has changed really was revealing to me. I don't know much about the politics of either South Korea or Japan. This question came in a similar vein. Can you, well, sure, Neysun.
Yeah, I just on this question of lasting effects, I just wanted to add a quick point. Because what I think is helpful to differentiate is lasting effects in terms of social practices, but also in terms of government structure and government approach. And the thing that I find, as many China scholars do, particularly aggravating about the Chinese case in this situation, is that there was a response after the SARS crisis in 2003 to create a Center for Disease Control, modeled after the US Center for Disease Control, to have a legal structure for reporting that was completely not used by the Wuhan local authorities when they first discovered the novel coronavirus in, I guess they probably discovered it in early to mid-December. And it wasn't until early to mid-January that the central government finally really learned about this and got involved. And so I think, just from that particular case, it shows that it's not enough to have a response at the formal level. It also has to seep deeper into practices. In terms of the big picture stuff that might happen as a consequence of this virus pandemic going forward, I think Eric's essay is fascinating on this point that the government in Japan tried to use the occasion to maybe change the basic constitutional structure and were unable to do that. I think that type of concern, many different countries, beyond even the ones that we've been discussing so far in this discussion, where there have been impositions on the ability of courts to review cases involved in challenging some of the aggregations of authority to executives in particular. Those big picture things, my sense, and I could be wrong about this, my sense is that they are gradually going to fade away because as different countries get more able to control the pandemic, the pressure for those kinds of big changes is going to be less. But the one thing that I personally would predict is going to be a lasting effect is precisely the topic that Professor Ko has been talking about, this electronic surveillance. That seems to me very clear that not only in South Korea, but in many other countries, possibly, we'll see what happens in the US, but there are some predicates in the US for more intrusive electronic related, whether we want to call it surveillance or we want to come up with another word, in relation to the pandemic that then could easily outlive this crisis. So I find the South Korean case particularly interesting because I think in some ways they're a little ahead of the curve of where I think a lot of other countries, including the US, may be headed. And that's something that I can very easily imagine us all grappling with for many, many years to come.
Rick, can I jump in for half a second?
Sure.
Just two things, one on surveillance and one on the CDC. On the CDC, there's been talk for quite a while, and that talk has accelerated about Japan needing a CDC. And you can quickly Google and find articles written by folks who say, look at the CDC in the US, it's a model for us. We shouldn't be relying on the Ministry of Health and Welfare, nor should we be relying on the National Institute of Infectious Disease, which has nefarious wartime roots. We need a new agency. It reminds me a little bit of the reform of Japanese legal education, where they said, look at American law schools, we need things like that. And it hasn't worked out very well. And I think those of us sitting in the US appreciate that while the CDC has a tremendous amount of expertise, we've not seen it operate in the way we would like it to have operated over these last months. And it's not clear that the creation of another government agency is necessarily a solution. I can't handicap the odds of Japan actually creating a CDC-like organization. But my guess is even if it does, that kind of institutional change isn't likely to make much of a difference. On the privacy side, there was a voluntary contact tracing app in Japan that people were asked to please download and use, and not many people used it. So it may be that the kind of changes that Neysun is talking about and Professor Ko is describing with electronic surveillance become more important in Japan, but there's so much non-electronic surveillance with the police booths and people coming to your house. And I think one often finds living in Japan that one experiences a significantly lower degree of privacy than one typically experiences in an American city. So while the electronics may come to the fore in Japan, I've not seen it in the same degree that we're hearing about in Korea. And my sense is it may be in some ways less necessary because there's all sorts of other ways of surveilling that don't rely on technology.
Mm-hmm. Now, by my clock, we have 9 minutes left. I have a couple questions here. And one of them I promised Eric I would ask him, but somebody else has asked it as well. So I'm going to actually just jump that ahead of the queue. And that question is, why are we so reticent to speak of cultural differences when other professions have categorized peoples of the world thinking about culture while warning of stereotypes, of course. Examples include collectivist versus individualistic cultures, family and versus community versus individual oriented societies, and this sort of thing. So Eric, you asked for it, you got it. Riff on culture, and Neysun and Professor Ko, by all means, pile on. But I think that's a nice general question to ask.
Good. So I'm not reluctant to talk about culture. I was asked to talk about law today, and law and culture are obviously intertwined, but I've tried to focus more on constitutional administrative law issues. But I spoke about culture without using its name earlier when I described the lack of legal sanctions that are available to enforce the government's emergency orders. There's no way of requiring legally that people don't go out unnecessarily or don't cross borders or that businesses close earlier, but that there's broad compliance with that. And when I say broad compliance, there's Google mobility data and cell phone data and other data that really can show empirically a significant change in behavior in Japan. And that seems to me to have something to do with culture, in the same way that, I'm in Philadelphia, we have a mask mandate, but it's very explicitly not enforceable. And the vast majority of people are wearing masks. So I don't like to think about culture, Rick, in the way Rick mentioned earlier, which is it's a residual bit variable. We should explain all the stuff we can measure, and gee, culture is too complicated. But I worry about speaking about culture often because of the way in which it's misused. So one has heard a senior politician in Japan, for example, talk about Japan having a higher level of culture recently. And that's why the coronavirus hasn't struck at the heart of the Japanese citizenry. We've heard about a factor X in Japan, some mysterious cultural trait that we can't measure or identify, but must be protecting us. Sometimes that means genetics. Sometimes that means something that we just, that nobody wants to say, but is there. So that kind of loose, generalized view of culture seems to me to not be very helpful. But the fact that in Japan, if one thinks that how we interact with one another and how we greet one another is inflected with culture, the fact that when I visit my in-laws in France, I kiss them 3 times. And if I kissed anybody in Japan 3 times, I think I'd probably be, someone would send me off to the local police station. You just don't greet people that way, nor do you shake their hands generally. You bow. So there, a cultural trait like bowing and greeting is clearly advantageous when it comes to limiting the spread of a disease. I think people are taught very early on in Japan that they need to behave in such a way as to ensure that their own behavior doesn't impose unnecessary risks on others. People have a tradition of wearing masks in Japan, not because it helps them stay healthier, but because if they have the flu and they're not feeling well, they appreciate that it's their job to not get other people sick. That's a learned public health behavior that I'd say one could call culture. People are regularly on subways and trains in Japan, not eating a lot, not talking a lot, not shouting, not boisterous. Often the trains are quiet. And when they're told by the government in the midst of a pandemic that they should speak less or not at all, they do it because it's part of what they've already done. Now, you can call that there's a broad-based Japanese deference to authority. That's mushier and harder to pin down, but it seems to me we can identify all sorts of specific behaviors that are learned, that change over time, that aren't always consistent. They may be different in Tokyo than Osaka. They may be different in a wealthy urban area than a poorer rural area where there's differences in culture. So there, maybe Japanese culture is too lumpy. Maybe we want to talk about Tokyo culture or Osaka culture. There's, after all, the epicenter of the coronavirus problem in Japan. So I think culture matters. I think behavior matters. And I think people's willingness to do what they're told matters. And I think of all of those things as culture. I just shy away from there's something mysterious and unique about the Japanese that has protected them from coronavirus, particularly because all you've got to do is look at Korea and Thailand and Vietnam and discover it certainly isn't a question of Japanese uniqueness here.
I just have to say that when I was teaching in Japan back in 2001, there was a debate about whether Japanese snow was different, because there was a big WTO fight about the import of ski equipment. And one of the reasons the Japanese government gave for why, they didn't want to lift tariffs on various recreational equipment was the snow was different in Japan. So I think that's what you're getting at, which is having an operationalizable variable to measure culture is really helpful, and the risk that you will treat the dependent variable, which is in some sense what you're observing, as the independent variable, the cause, basically putting it on the left and the right side of the regression equation, the same darn. Yeah, that's a big risk. Neysun and Haksoo, what do you think?
And
We don't. By the way, I should say, I don't know how strictly we're going to stick with time, but there's only 3 minutes left.
Yeah, I'll be very quick. I loved Eric's answer. And I have to say one thing I really liked, a point that he referenced now that he also made in his paper, is whether or not the Japanese tradition or culture, whatever word we want to use, of bowing has had, we're all elbowing each other. And it's interesting to kind of think about something as simple as that as having had a role. But the two things that Eric said that I really want to amplify because I thought they were really good. One is I think we should be talking about culture, but we don't, in part because we don't know how to. And we tend to not be able to do it without being essentialist. So that's just something we also need to get better at, is to how to talk about this stuff without being essentialist. If we could do that, then I think we can make a real contribution. And the second was sort of a smaller point in what Eric said, but I've been thinking about it a lot too, is it's not just across countries, it's even within countries, right? So in China, there's this notion of quality, right? Like high quality people, low quality people. We certainly have similar types of tropes in our US discussion, and those are problematic too. So, there are ways I hope we can talk about this stuff that talk about social learning, that talk about, the dependent variables as opposed to the independent variables that are sophisticated and helpful and explanatory, but don't fall into these pitfalls that is why we tend to shy away from talking about this stuff.
Haksoo, it looks like you're going to have the last word at 11:29 my time.
Okay, I'll be short. Culture is important, but it's hard to generalize or hard to theorize. And for example, in the case of wearing masks in South Korea, different from Japan, until this year, not many people would have been seen wearing masks when they have flu or something. In Japan, that was popular even before the COVID pandemic, but in South Korea, it wasn't popular. But nowadays, I would imagine if even after this pandemic is gone, people would be wearing masks when they have flu or something. So culture is changing, and also about surveillance, for example, using QR code at a restaurant or business establishments. Perhaps until last year, it would have been unimaginable to have that sort of requirement in the whole any society in South Korea. But nowadays, this is so familiar, became so familiar within just a couple of months, and everyone would be willing, perhaps at least apparently willingly use the QR code. So that's sort of social norm and culture is very quickly changing, particularly in South Korea, and people you kind of change dramatically very easily. So we need to see that aspect.
Well, on that note, I guess I want to say thank you so very much for everybody coming here, for the questions that were asked, and for these great presentations. I learned a ton, and I really appreciate it. Next week, we have presentations on Vietnam and COVID, and I'm hoping that a lot of people who show up for this conversation will show up for that as well. So I'm going to say goodnight to you in Shanghai, and thanks for coming.
Thank you.
Thank you.
Thank you.